Hi, Dr. Sarah Ernst here of the Ask Dr. Ernst Show on News Talk 1110 WBT every Saturday at 3 p.m. Today we're talking about depression. Did you know that 1 out of 10 Americans suffers with depression and that number increases by 20% every single year? Antidepressants are the most commonly prescribed drug out there today. And did you also know that depression is actually not caused by an imbalance in brain chemicals or a psychiatric illness? It has to do with your physiology. It has to do with how your body works as a whole. Depression actually is due to chronic inflammation in the body. There's several things that cause chronic inflammation. One of them is stress. I know we all have stress in our lives, but chronic stress, emotional stress, physical stress, and chemical stress can all cause chronic inflammation in the body. It is the most common factor for depression. Another reason for chronic depression can be a toxic mold exposure. This can be molds and funguses that are living in your home. We're all exposed to some sort of molds in the outside environment, but this can be something that's actually maybe even developing your work area or even at home. The third most common cause of chronic inflammation in the body is antibiotic usage. Antibiotic usage actually decreases your immune system, killing off the really good bacteria that your body needs in order for it to survive and heal. And the last one that causes the most chronic inflammation is sugar. And I'm not just talking about that white table sugar. We're talking about sugar in everything that we eat, even fruits. Sugar can cause insulin resistance and leptin resistance. Those are the most common hormones that help us regulate our blood sugar and help us burn fat for energy. The last thing is that sugar also suppresses what's called the brain-derived neurotrophic factor. And this is what creates healthy neurons in our bodies. So there you have it. It's not due to a psychiatric illness. It's due to chronic inflammation. So those drugs that you're taking, if you have chronic inflammation, are only sedating you. They're only covering up the problem. So what can you do today? Well, a couple things that you can do to help with depression. Number one is we have to find out what's the cause of the chronic inflammation. Okay? We do that really well in how we do it in our offices. But some of the things that you can literally step out your door and do today is number one is making sure that you have enough vitamin D in your body. Okay? That is an amazing hormone that helps with all hormone processes in the body and even helps our immune system. Number two, you want to make sure that you have healthy, good fats, omega-3 fats for helping that brain development. And number three, you want to get some sun exposure. This is a great time to do it in the summertime to get some sun exposure. At least 15 to 20 minutes without any cream on, any sunscreen or sunblock. That way, that helps the body also get more vitamin D, and it helps regulate your sleep hormones as well. Thanks for joining us today. We look forward to having you on our show on Saturdays at 3 p.m. Have a great day.